How much does a Singapore doctor really make?
She works 80-hour weeks. She holds strangers' lives in her hands. And as a houseman, she takes home about $4,500 a month. A top specialist? Well over $50,000. This is how much a Singapore doctor really makes. Tonight, you live all 8 tiers of a doctor's life in Singapore, from an exhausted houseman on her first night shift to the very summit of the profession. 8 tiers. Tier 1 starts now.
Tier 1. You're a houseman, a first-year doctor. 5 years of medical school are behind you, and now you're on the wards for real. 30-hour shifts, bloods, discharge summaries, and a pager that never stops. You earn around $4,000 to $5,000 a month, and you're tired in a way sleep doesn't fix. But at 3 in the morning, you catch a patient going downhill before anyone else does, and you realize you're actually a doctor now.
Tier 2. Medical officer. You've survived housemanship. Now you run the ward more independently. You clerk the emergencies, you make the calls while the consultant sweeps. You earn around $5,500 to $7,500 a month. Some nights you hold a stranger's hand as the worst news of their life lands. You learn that medicine isn't just knowledge, it's carrying people, and you start to choose what kind of doctor you want to become. Tier 3. Registrar. You've chosen your specialty, and now you're training in it, deep. You lead the junior doctors, you assist in theater or run the clinic, and you sit the brutal specialist exams. You earn around $8,000 to $11,000 a month. Every hard case sharpens you, and after years of nights and exams, a letter finally arrives. You're a specialist. Tier 4. Associate consultant. You're a specialist now. Your own patients, your own decisions, your name on the plan. You earn around $12,000 to $16,000 a month. The training wheels are off. The responsibility is entirely yours, and you prove to them and to yourself that you can carry it. Tier 5. Consultant, a senior specialist. The complex cases come to you, and the junior doctors watch how you think. You lead a team, you teach, you push the whole department forward. You earn around $16,000 to $22,000 a month. You've become the doctor that other doctors call when they're stuck. Tier 6. Senior consultant. You're now among the most experienced in your field on the entire island. National guidelines, the difficult referrals, the cases no one else will touch, they land on your desk. You earn around $22,000 to $30,000 a month, and a choice appears: lead the department or take your name and your expertise into private practice.
Tier 7.
Head of department. You run an entire clinical department in a major hospital, dozens of doctors, thousands of patients a year, and the training of the next generation. You earn around $30,000 to $45,000 a month. You shape not just patients' lives, but the practice of medicine itself. And beyond the hospital walls, there's one more tier, where the ceiling disappears. Tier 8. The summit. A renowned private specialist. Years of reputation behind you. Patients now fly in just to see you. And in private practice, the earning ceiling all but vanishes. Well over $50,000 a month, sometimes far more. But on a quiet evening, between cases, you remember an exhausted houseman on her very first night shift, terrified, clutching a pager. Tier 1, the very beginning. That's the life of a doctor in Singapore. Houseman to the summit. 8 tiers, 1 calling, and a whole lot of sacrifice behind every dollar. Which tier would you have stopped at? Tell me below. And next episode, another Singapore life, with a number that'll surprise you. Subscribe so you don't miss it. Meet the Dymo-WhatIf family. Our nurse, our F&B server, our pilot, our teacher, our police officer, and now our doctor. 6 women, 6 very different paychecks. Whose life should we live next?